we were able to stand up our first non-VEEP alternative testing site today at the Wheaton Library and Recreation Center. As you know, increasing testing capacity and access to testing is one of our priorities because we recognize that it is important not only to understand what the true impact of COVID-19 is on our communities in the acute setting to better manage it and minimize transmission. We also know that having increased access to testing will be very meaningful to help guide the decisions we make in terms of whether, how, or when we open up our society, so to speak. So we launched that test site today. It went very well, and we will be doing that test site at the Wheaton Rec Center and Library on Wednesdays, and we will be launching a similar site at the Germantown Upcounty Regional Services Center on Mondays, and that will start on next Monday. These sites will utilize a platform similar to what we have now with the VEEP testing site, where providers will order the test through the CRISP system. We are working on building a hotline system where, because we recognize that having access to a provider is still a bottleneck for many folks and a limiting factor. So we are working on creating a hotline where residents can call in, speak to a provider, get screened and triaged, and if they are determined in need of a test, that order will be referred, that will be placed in the system by that provider on the hotline service. A couple of other things we've been working on. We have created some more go teams and strike teams, so to speak. As you recall, we created some for our nursing home programs several weeks ago, and recognizing that there are a number of other facilities such as D&D group homes, developmentally disabled group homes throughout the county. We worked with our colleagues in Aging and Disability Services to train a number of their staff to be able to provide a similar service to D&D group homes throughout the county. We've spoken with our colleagues at the state, including Secretary Beatty, who are aware of our efforts and support those efforts because we recognize that those homes have a unique set of needs also. And again, the goal of strike teams is not to be punitive in any way. It is to address and offer an added layer of support to make sure that we have a better understanding of what the needs are, whether that is guidance on infection control, how to deal with positive cases, how to make provisions for staff and other residents to get tested, as well as doing an assessment of their access to personal protective equipment should they need that.